Hi there. Today we're kicking off a new series under the Care Anywhere podcast banner called From the Bench, where we're going to be diving into the research side of global health workforce development issues and challenges. I'm starting today with Lauren Herckis, who leads the research center of TruMerit's Global Health Workforce Development Institute. Lauren has a wealth of experience in evidence-based research along the lines of education systems and workforce analysis. And she's bringing all of that experience to bear on her role here in leading the research initiatives for TruMerit's Institute. She is a wealth of knowledge, such a smarty. You're really going to enjoy this conversation, so stick around. Critical shortage, maldistribution, climate impact, tech readiness, and career mobility. These are the challenges facing global nurses and allied health workers today. We're looking at the numbers, the data, and the research on this episode of From the Bench. Brought to you by TruMerit. Hi, everybody. Welcome back to Care Anywhere. I'm your host, Lea Sims, and I am joined today by a colleague and friend, Lauren Herckis, who leads the research arm of our Global Health Workforce Development Institute here at TruMerit. This is the first episode of our From the Bench special series for Care Anywhere, where we're going to really be diving in deep on primarily global health workforce research. Who's doing it? What we're doing in our institute, how we're synthesizing some of the research out there and developing new insights and new analysis that's relevant to all stakeholders in this space. So, Lauren, welcome to Care Anywhere, to From the Bench. You're our first
Thank you.
guest, and I'm so excited to have you on talking about the work that you're doing. You've been with the Institute now well over a year and really helping shape what the research framework for the organization is going to look like. So I'd love it if you would start by just introducing yourself and telling our audience a little bit about you and, maybe some of the background in research that you've had. You come to us with a lot of credentials and a lot of expertise. We're so thrilled to have you here. So welcome, and tell everybody about yourself.
Thank you so much. It's wonderful to be here. All of my credentials, all of my degrees anyway, are in anthropology. So I'm an anthropologist by training. I've done research on a number of topics, though. Before coming to TruMerit, I worked with the Inter-University Consortium for Political and Social Research, and with a great team studied a whole variety of different national and local social science and policy questions around the United States. And then I went to the Department of Veterans Affairs Center for Health Equity Research and Promotion, where we were really focused on issues facing veterans in securing effective health care and health services. Before coming to TruMerit, I spent nearly a decade at Carnegie Mellon University studying educational technology in the face of rapid global digitalization with a focus on evidence-based practice. Evidence-based practice was a new concept for ed tech. Learning science research and cognitive research on teaching and learning had been around for a while. And it's hard to imagine that evidence-based practice wasn't really something folks talked about. But
you would think that would be the underpinning foundation of all research. But
that's right. But it originated in healthcare. Evidence-based practice was new in medicine in the early 90s, and it took coordination and roadmaps from the U.S. government and a lot of hard work on the part of researchers around the world to really develop evidence-based practice as a way of doing medicine and for it to become globally accepted as a important way to think about medical research and practice and health research and practice. But for the education sciences, it was a new concept. It's something we started talking about in the delivery and the development of assessments and certifications, teaching and learning opportunities only about 15 years ago. And thinking about what it might mean to take an evidence-based approach to designing assessments or exams or learning experiences, and then measuring outcomes and changing models and approaches based on data, that was pretty new and very exciting. So a lot of my work with Carnegie Mellon has been about the innovation as technologies change and we live in a very interconnected world. how can we think about doing evidence-based practice in teaching, learning, and assessment on a global scale. So coming to TruMerit was really exciting. The organization and the priorities at TruMerit really give me the opportunity to work at the intersections of these different research
really
efforts
does.
in my past.
It really does. So all of that, the timing couldn't be better, obviously, as we're launching this institute. But we're, as most people know by now, we are expanding from our historical role as an evaluation and assessment company, though evidence-based research underpinning all of that is still going to be critical to us long term. But we're also looking, more globally about how to support the career mobility and career opportunity and education and training and validation of skills and learning for health workers globally. So all of that, I know, is sort of created this perfect moment in time for you to bring all of that experience into where we're beginning to build that out. Can you talk about what the overarching goal of our Global Health Workforce Development Institute is and where research is playing and is going to continue to play a part in the work of the Institute?
Well, you just said it so beautifully. I'm not sure how much I can add. The TruMerit has been
Didn't
around.
mean to steal your thunder. It was setting
No,
you up.
but that was perfect. In a nutshell, TruMerit has been around for a long time and has been serving a really critical role in arenas like credential evaluation. But the global landscape has shifted quite a bit in the last 5 or so years, right?
Yes,
both in terms
definitely.
of how we think about mobilizing health workers from around the world in moments of need, and also in terms of the ability of anyone aspiring to a professional move to take control of their own professional journey, to think about where they might take their skills and practice. Really critical pressures right now to think about how we mobilize a health workforce on a global scale to empower people to take their careers where they'd like to go next, and to ensure that health systems, care delivery systems are able to meet the needs of local populations of all kinds, wherever they are and whatever their needs might be, and however rapidly those needs might change.
Yeah.
So in this particular moment, as you say, we're really uniquely aware of some of the new and emerging challenges and uniquely positioned to address those. But there's not a lot of work that can be done across jurisdictions or on a global scale. Most organizations are positioned firmly within a local context, within a region, within a
geographical
nation.
boundaries.
That's exactly
Yes.
right.
Yeah.
And so our ability to really turn towards global challenges and address them with data is unique. So we're conducting research to support global stakeholders and to improve healthcare service delivery through evidence-based decisions. And part of the core mission of the Institute is to use research to build the intellectual capital of the global community and advance scientific knowledge about health workforce development, lifelong learning, and care delivery issues worldwide. So that means we can also use the work that we do to inform policy and care model evolution, our own work on, at TruMerit's core services and our partnerships with leaders around the world.
Well, and what's interesting to me too, Lauren, just having watched this evolve over the last 18 months or so, the launch of the Institute is, as you said, how siloed a lot of it's not that some of this workforce research doesn't exist, but it exists at a very local or regional level. It's very siloed. It is health system specific. And there aren't a lot of organizations out there who are looking to synthesize that research and pull it together and really look at the correlations and trend data and all of that. And I think that's some of what you guys are doing over there in the Institute that, like you said, it's one of those, it's going to raise all boats, so to speak.
That's right.
To be able to do that. So I would just say for our audience, we will be doing some of our own ground up research, but a lot of what we'll be doing there is pulling on that research that has already been done, but is regional, and then, looking at that on a more global comparative or correlative way. So I think that's, powerful. We're We're going to
Absolutely.
be doing our own, but a lot of it is synthesis of data that already
Well,
exists and hasn't been
evidence
looked at.
synthesis is really critical. And, thinking about the kinds of gaps or disparities that exist out there, where we're thinking
Yeah.
about, you know, what we know and what we don't know, but we really
Right.
need to know in order to move forward. There's a lot more research conducted in and by the global north and the global south. There is much more research conducted in and by researchers in urban areas than rural areas around the world. Most of what we don't know are the the very things that we most need to know in order to
Yes.
help the
Yeah.
most needy and in order to ensure that we're doing the work that's going to make the biggest difference. And by we, I mean the global community, right? And so, as you
Yeah.
say, a lot of the research about health workforce development takes place at local levels, within communities, within regions, even within nations.
Right.
So, if we're looking for implications across contexts, research that continues the global nature of challenges that face human beings on the planet today,
Yeah.
that's a little more challenging, but we can leverage work that's been done. We can partner with folks around the world and ensure that we're doing the kinds of work that needs to be done in order to fill those gaps. Our global focus and our international relationships give us opportunities to really answer critical questions about how we can best support the global health workforce.
So you mentioned the needs. That's a great segue into the next question. Where is research needed? Where are you finding as you dig in on all of this that there are gaps? Where just more evidence is needed, more data needs to be gathered, more surveying, more digging in. What are you seeing?
Oh, there are so many great places to start. One area that we're really interested in is exploring system strengthening strategies that can support rehabilitation care delivery. Because it's one thing to say this strategy or this policy is really effective. And it
Right.
might be, but usually these kinds of strategies are context dependent. And so saying, well, one of these might be effective only goes so far, right? So among other things, we're exploring the kinds of system strengthening strategies that can support rehabilitation care delivery that might be context dependent, and how policymakers and administrators in local contexts can make evidence-based decisions about strengthening those systems. So there are a lot of different questions that go unanswered, and we are committed to finding the opportunities to build knowledge that's actionable, that's useful, that's valuable for
Right.
folks around the world by working with partners in organizations and contexts that are diverse.
I think that's an important piece to mention there. This has to be a collaborative, partnership-driven approach. There's no one organization that would have the bandwidth or resources to really tackle it all, especially right now when people are increasingly more resource-strapped in this space. So pulling on other organizations that we work with is a critical part of this strategy as well. I mean, almost everyone knows we launched a partnership this year through the Institute with the International Council of Nurses to really look at nursing workforce research specifically. And I know you're really looking beyond just that one health occupation or topic. But yeah, I think the collaboration piece is really critical for sure.
Yeah. We have some really interesting data at TruMerit, and we're collecting new original data in partnership with folks at a lot of different institutions around the U.S. and around the world. And as you said, we're doing evidence synthesis and kind of pulling on the kinds of research that have already been done to interpret them and understand them in new ways and identify the most important and best next steps for research agendas that can inform the critical decisions that need to be made now.
Yeah.
But we can only do that when we have great partners. And we've been really lucky to work with scholars, students, administrators, policymakers, and interested parties around the world. Some really wonderful people who are committed to rigorous and high quality research for the greater good.
And driven by a curiosity for
Yes,
figuring it out, which is
that's
really
right.
great. So let's talk about what What has been the research focus of your team so far? I would say in the last 18 months or so, since we got this off the ground. What topics are you really looking at? And I'd love to talk a little bit about the process of, how that research comes together and what you do with it. How does it get out there in the world? If for our audience, it might not be researchers or familiar with how that works. When we say rigorous process, that's an A to Z proposition. So, but let's start with what your team's been working on. Like, what's been your focus in the last 18 months?
Well, so that's a great question, especially for folks who aren't familiar with research. They may not know that it takes a lot of infrastructure. So a lot of what we did for the first, much more of the first year than I would have liked. I would have liked to have more time to dedicate to other things, but was set up infrastructure. Original research requires structures that not all organizations have, and that before the Institute came into existence, TruMerit didn't have in the past. So building the organizational capacity to develop or submit or monitor grant proposals. So if you want to do research that's funded externally or by foundations or government agencies, that takes some policy and infrastructure work. And then managing and effectively using grant funding. When we have grant money coming in, we've had to monitor it and report on it in ways that are pretty unique to other kinds of money management questions. That's a huge task. And so we registered with all of the federal and international bodies. We created all the protocols and processes that we needed to get our project management ducks in a row. So in order to conduct original research, we had to take all of these steps that as an organization, we hadn't had to consider before. Research methods that we can use to learn new things about human activities and experiences are regulated by the United States government. And research data is regulated differently from other kinds of data. So we spent a lot of time in the first year making sure that we'd be able to conduct human subjects research, which is research where you collect information about and from people, as opposed to books or articles or, there's a lot of research that's excellent and important that's not human subjects research. But the minute you want to start asking people questions, observing them, and especially collecting, biological samples, there are a lot of regulatory hurdles to jump for excellent reasons, regulatory and ethical. So we spent a lot of time making sure that we'd be able to conduct human subjects research in legal, ethical, and methodologically sound ways. But while we were putting all of that infrastructure into place, we started working on projects that will lay the groundwork for a longer term agenda. So we've done, as you mentioned earlier, systematic reviews. Almost anyone who wrote a research paper in high school had to go to the library and find the books that describe what's known about a topic. Research librarians and folks who conduct systematic reviews do that on a method of rigor and precision that you can't even imagine. It is so finicky, these approaches to reviewing the existing literature, that when you're done, you can say with a very high degree of confidence, here's what's known, here's what's not known, here are the approaches that have been used to, for example, understand how and where rehabilitation care has been integrated into primary care in service delivery. Here's what's known, here are the gaps, here are the things we don't know, and here are the questions that we really need to answer in order to take next steps. So if that describes the universe of what's known and what needs to come next, then it positions us to design really solid projects built on that foundation. So we've been doing a number of systematic reviews to better understand the really unique problem space that we're in, and from which to launch partnerships and new, especially human subjects research in the future. We've also been able to do some human subjects research that we've gotten started, such as a study about system strengthening strategies in rehabilitation care around the world. And we've also been working with the data that we have, secondary data analysis. When you have data that was collected for a different purpose, using that to learn new things is feasible and takes a little bit of data management and statistical magic, but you can do all kinds of really interesting things. And we've been able to learn a lot about nonlinear health worker migration patterns. So, people who move from one place to another throughout their professional journeys. And a lot of really interesting topics by using the data that we already have.
That's amazing. You basically putting a different lens on data we've looked at before, which I think is amazing and certainly relevant to the work we're doing. So I can really appreciate what you said there about the time that you spent in that first year building infrastructure and really laying the foundation for a disciplined, rigorous, credible research program and process. I can relate in the sense that I had to do the same thing here with marketing and communications because I remember saying it's going to take at least a year just to build the engine, to lay the foundation to do those things well. Yeah. And I'm a big believer that taking the time to do that produces a lot of fruit later when you do it the right way. So kudos to you and your team for really looking at piece by piece from the ground up, really from scratch, building that program out and the work that you're doing there. I'd love to touch a little bit on the rehabilitation system strengthening research that you said that you were doing for our audience. We've been talking on this podcast for the last year about the credentials we've launched in the rehab space and the exams there and how important that is. Could you touch on why system strengthening would be particularly important in rehabilitation care? That's a almost crisis level area of healthcare right now globally. When you look at the number of people who need rehabilitative care, don't necessarily have the workforce resources to support that, may not have the systems infrastructure to support that. So I don't know if you're prepared to talk about that a little bit, but I thought it would be great to share why that project particularly is timely and critical to a lot of the other work we're doing in the rehab space as an organization.
So we have a number of systematic reviews in process to explore rehabilitation care delivery around the world from a number of different angles to better understand how it's delivered and whether there are actually roles or services that are explicitly for rehabilitation care or whether it's part of a larger service and maybe unmarked or not considered as a unique and needful kind of health service.
Yeah.
The fact that rehabilitation care is not defined or understood in the same way around the world means that care systems are different from one place to another, and that efficiencies and the kinds of interventions or delivery mechanisms that are really effective in one place might not even be documented in ways that are recognizable to policymakers or practitioners who are operating in a different system, where people use different terms to describe the same kinds of support, or where there are different, even, care delivery structures more broadly within which people who need care are seeking rehabilitation care.
Yeah.
And on the other side of that, there's the educational experience, right? So who are we training to be the next generation of rehabilitation care workers? And what skills do they have? How do they get those skills? How do they understand those skills as being supportive of rehabilitation care delivery? Because educational systems are different from one place to another. Yeah. And recognizing the skill set or skill sets really that are required for rehabilitation care, even for one type of chronic condition in one type of care delivery context, one kind of system.
Yeah.
That's really hard to do. That's really unusual to document. And so understanding that landscape has been where we start. What kinds of training exist? What kinds of training are recognized? What kinds of skills are recognized as critical, and which kinds of skills are commonly employed but taken for granted? So that's at the individual care delivery level or within a clinic or a community or perhaps a hospital or hospital system. But when we start thinking at a larger regional or even national or international level,
Sure.
how can we think about creating policies or structures that really enable care delivery systems to work more effectively, to ensure that care is delivered to the folks who need it when they need it, as long as they need it.
Yeah.
So
what I really hear you saying there, and so much of that, is that the lack of global standards. It's standardization that's really, missing in that discussion, because you're talking about variability that's local or regional or systematic. And the work that you're doing, the way that this kind of research can really drive collaboratively, people coming together and saying, what's the common practice here? Where can this research actually underpin the development of standards and frameworks and things like that? And certainly that has informed some of the global competency framework building we've been doing around some of these, especially in rehabilitation care. So thank you for diving a little bit in on that, because I know it's so relevant to so much of what we're doing as an organization right now. In the research that you've been doing, has there been anything that surprised you or confirmed any suppositions that you had, or has it all been just sort of a new frontier?
Well, some of everything, right? It is, it's always a new frontier, which is part of what makes it really interesting.
Yeah.
But there are regularly insights and discoveries that are super exciting and really interesting. And I know that as our efforts continue to snowball, there'll be more and more of those. But I mentioned earlier that some of our studies look at nonlinear health worker migration patterns. One, we were exploring the patterns of health worker migration since the onset of the global pandemic in 2020, and compared how those trends line up with general global migration patterns that are outlined with the International Organization for Migration and nurse migration patterns described by the WHO and OECD.
Right.
So we were able to explore professional and demographic trends, practitioner trends, especially where nurses are initially educated and licensed before they start their transnational journeys. And then we can describe the kinds of sending, intermediary, and receiving destinations for nurses. So one insight that I think is really interesting is that we see primarily stepwise migration patterns, which means we're not seeing many professionals returning to the country where they were educated once they found work in another country, in a destination country. A significant proportion of nurses that migrate to the U.S. have already moved along multiple steps in a professional journey. So a lot of them get their educational credentials somewhere other than where they were born. And then they have their first licensure and professional experiences in yet a third country. Yep. So this means that the internationally educated nurses that are coming to the U.S., many of them have really diverse educational and practice experiences, which really uniquely positions them for working in the United States.
I would say that's been confirmed by almost every migrant nurse guest we've had on the podcast in the last year. This, multinational pathway for getting through their career journeys from, early education to advanced degrees that maybe they couldn't get where they were. They go somewhere else to continue to move up that value proposition pathway. And a lot of times then end up, ultimately where they want to work. A few of them go back to take what they've learned, and sometimes after many years of working in the country they've migrated to, and go back to build infrastructure and capacity in their home countries. But that's more rare than the ones that stay, I think.
That's true. But, even the folks who don't take a circular path and go back to their country of education or the country where they were born, maintain those ties. And so we've also done some really interesting work on global care chains and folks who move for their professional career, but have family, community, and folks at at home or back where they
Yeah.
were home, where they send remittances or send information, offer guidance and mentorship to folks who are building infrastructure and new practices there as well. So
Yeah.
I'm really excited to dig further into some of those questions of global care chains as well. But
Yeah.
to your point, there have been some really compelling, very interesting, very useful research where individual or small cohorts of practitioners in specific contexts are interviewed, and we have so much narrative data talking about individuals' experiences, but the trends on the aggregate, how common these are, where they unfold and don't unfold, or where they're having more of an impact on workforce development, or are responding to policy shifts, not as individuals, but in trends. That's harder information to come by in the literature, and so we've been really excited to dig into some of those questions from our position.
So some of your work is starting to get published, and kudos, congratulations on that, because I know it takes a bit. Again, I don't know if our audience is necessarily as familiar with the rigors of just getting those that research published and positioned for peer review or in academic journals. But how does that process work? Without
what a great question.
going too far into the weeds of that, but how do we decide when and where we share those results, and what goes into that process?
What a great question. Yeah, it's really interesting. Researchers have accepted methods that sometimes they've spent years and years and years developing, and most research methods are well established within disciplines. There's a way to do it right, and if you don't do it right, then you're doing it wrong, and whatever results you might think you have aren't very reliable. So using robust and appropriate research methods to derive any kind of new insight is really important. Yeah. So in the research world, there's this whole peer-reviewed process you mentioned, whereby somebody says, I did science, I learned something new. Look at what I learned. How great is this? And then the rest of the research community says, hold on a sec, we need to check your work first. So submit an article, and we're going to have this double-blind peer review where the people who are reading your article don't know who you are and you don't know who they are. And there's a step-by-step process. They read and make sure, is the method correct? Are the findings appropriate to derive from that research process? Is this something that's needed and hasn't been done before? Or did you just kind of reinvent the wheel? How does this contribute to our understanding of the world or this particular topic? Why do we need to know this? Have you crossed all of your T's and dotted all your I's? And then the authors get back this response that says either, great work, no changes, we'll publish it. Although I've never heard of that happening to anyone. Or,
human nature being what it is, I'm sure people have a little insight, feedback they want to give. Yes.
That's right. That's right. Usually it's something along the lines of, this part wasn't very clear, so make sure you clarify it. Or, this doesn't seem like the right method, so we need to understand more in order to make sure it's correct, so modify this piece. Or, the findings that you derive don't seem exactly right, so maybe you should explain. Or, these folks in this place a few years ago did this thing that you don't mention, but it really affects the way you understand the results. So those kinds of feedback, they generally serve to really strengthen an article, to make sure that it takes into account all the things that it needs to take into account. It's the way that the research community can catch those projects that maybe weren't well thought out or weren't well executed, or where folks didn't do their homework before they did the science.
It's accountability, right? It's holding
yourself
and your research accountable to close scrutiny. It should hold up under close scrutiny, right? And I would think that would be
that's exactly right.
A critical part of that process.
But then what happens, let's say you pass through all those gates, your work is given the thumbs up and you're published in a peer-reviewed journal. Most of the time, those publications are not, they're good bedtime reading. They can put you to sleep, but they're not really exciting. They vary the lead. They don't really, they're really engaging if you are a researcher who's studying that topic or gets really excited about research methods. But that means, publishing in peer-reviewed context is important for, as you say, accountability, replicability, really validating that the work that was done well and appropriately and was needful. But in order to make that really meaningful and accessible to more people, then a very different kind of writing or a different kind of sharing is important. So talking about those findings at conferences or in industry venues or even editorials or, in places where they're a little more accessible, both, literally accessible, easy to find, but also without burying the lead, without spending 10 pages talking about how many people you interviewed on which days and using which protocol, but just talking about what you found and why it's important. So for the most part, we're trying to think about the projects that we're doing as informing future work for the Institute. And also, what can we learn from them that is rigorous enough to get that stamp of approval from the scientific community, and also meaningful enough that someone will care when we share it in these other contexts.
Yes,
That's right. That we can explain why it matters.
Yeah, that's great. Well, that is one of the reasons I want you to come back on this podcast periodically so that we can do that and really pick a topic that you're working on.
Fantastic.
We don't have time today, but I know you've been doing a lot of work looking at AI and fraud in the credentials evaluation process and just AI in general. I've been following some of your posts and shares on LinkedIn, and I know you've been at a few conferences lately. That's a whole game changer, AI in this space.
It really,
I imagine, and how
in
it's
every space
supports research and what you need to be careful of and what the guardrails around that would be. So I'd love to have you come back on and talk about that, which leads to the final question. What's on your roadmap as the Institute continues to ramp up this year and head into 2026?
Well, that's a great question. I think that the answer is pretty similar to the answer I gave earlier, where, we have a fairly well-defined scope of work. We're really interested in conducting research on global health workforce development. We want to make sure that we're building on the work that's been done before. And so the results of a lot of our systematic research are going to determine some of the next directions for us. But we also want to make sure that we're doing the work that's critical to the global community. So emerging policy challenges and practice challenges, they will also be really important as we determine what comes next. Now, there are a number of things that are already in the works that, of course, will continue, and really excited to see the results of research on nurse migration around the world and system strengthening strategies for rehabilitation care delivery. We're doing some great comparative analyses of care delivery models in different kinds of contexts. So those are all in process, but also coming down the pipeline. And AI has been a hot topic for a while, but that's because it's emerging and really rapidly evolving. It's changing the landscape every day. And so making sure that we're on top of those changes is critical, both in order to ensure that we're using AI in appropriate ways, but also to ensure that we're aware of the ways that AI is being used for things like employment fraud or credential fraud, because it is being used in all of those ways. And so ensuring that we are on top of the state of the art and also, the current pressing questions around how best to use AI to combat fraud and to understand how AI may be used to perpetuate fraud in credentials is really critical. So we've done some recent research, and we're excited to do more.
I love that, and it may seem like a very nuanced topic. It's obviously very critical to us because we do the credentials evaluation piece and need to stay on top of that. But really, the broader issue of fraud in the credentials arena has far-reaching implications around health workforce anyway, from
Absolutely.
training and opportunity and recognition and all of those things. I think it's a critical thing to keep an eye on. So I want to have you back to talk about that. I imagine we will be having a discussion in January or so around our nurse migration report, which we'll be publishing, I think, in January. And I know your team is really, deep into that data and helping to prepare that report. So we'll have you back on to talk about that. Lauren, thank you so much for joining me here today, for helping us kick off this research and evidence-based research focus of our podcast as we really look at all of the implications globally around our workforce, the challenges and opportunities that they're facing, and how we're connected to that ecosystem more broadly. So thank you for being here. Thank you for sharing your experience and giving us a peek at what the research team is up to over there at the Institute. And we'll have you back soon. Thanks so much.
Thank you so much for having me on, Leah.
Yeah, absolutely. All right, everybody, that's this episode. We'll see you back next time. Thanks for joining us on this special From the Bench series with Care Anywhere, the Global Health Workforce podcast, brought to you by TruMerit. Thanks so much. Thanks for tuning in to this From the Bench special episode of Care Anywhere. You can find TruMerit research by visiting our research hub at trumerit.org. If you're new to Care Anywhere, you can find all of our podcast episodes, including From the Bench, at trumerit.org/podcast or on your favorite podcast streaming channel.